Post-operative instructions, general. Often, the after effects of oral surgery are quite minimal, so not all of these instructions may apply. Bleeding. Bite on the gauze firmly for at least 45 minutes at a time after you leave the office. Avoid removing the gauze too early. A common mistake is to remove the gauze 10 minutes after placing it to check for bleeding. Keep it in for at least 30 to 45 minutes with firm pressure to establish a good clot. If bleeding persists after several cycles, place a moist tea bag wrapped in gauze and bite firmly for at least 45 minutes. It is normal to have a small amount of bleeding for the first 24 to 36 hours. Pain management. Stay ahead of the pain for the first 3 to 5 days. This is very important. Take your first pain pill, which is usually ibuprofen, before the local anesthetic has worn off, and then in most cases, alternate acetaminophen, or Tylenol, and ibuprofen, or Advil, every 3 hours. Set an alarm and wake up to stay on schedule. This is key to minimize peak discomfort. If prescribed, use a stronger narcotic pain medicine every 4 to 6 hours as needed. Always take the pain medicine with at least a small amount of food, as this will help prevent most instances of nausea. Swelling. Some swelling is normal and can be minimized but not necessarily eliminated with the following tips. Apply an ice pack 20 minutes on and 20 minutes off during the first 48 hours after surgery. After 48 hours, you may switch to warm compresses, again 20 minutes on and 20 minutes off. The warmth will help decrease some of the soreness and stiffness that happens after surgery. Keep your head elevated for the first few days after your procedure, and the easiest way to do this is to prop yourself up with several pillows. 6 things to avoid for the first 5 days in order to minimize complications or your risk for a dry socket. Do not use a straw. This can dislodge the clot and promote a dry socket. Do not smoke, as it compromises the blood supply to the area and can also promote a dry socket. Do not rinse vigorously for the first 3 days, but mild swishing with Paradex is okay. No hot liquids while you're numb. You might accidentally burn yourself. No spitting. Just swallow normally. You swallow saliva all day, every day. This should be no different. Spitting can actually dislodge the clot and promote a dry socket. No carbonated beverages. These can dissolve the clot and not only promote a dry socket, but they can lead to prolonged bleeding as well. Diet. Be sure to eat nutritious food and drink plenty of fluids. If you eat nutritious foods and stay hydrated, you will feel better, gain strength, and have less discomfort. That'll help you heal faster. Avoid foods that will be difficult to irrigate out of the sockets, especially after wisdom tooth surgery. Small things like nuts, sunflower seeds, popcorn, potato chips, rice can get stuck in there and really cause a problem for you. Softer foods like mashed potatoes, pasta, scrambled eggs are best for the first 3 days. After that, as the swelling and the discomfort gradually decrease, you'll be able to chew more solid foods. You can avoid muscle spasms by stretching your jaw back to the normal range of motion as you tolerate it. If you have had a bone graft or dental implant, it is critical to avoid chewing on that site, as that can lead to failure. Irrigating syringe. This is the most important thing to do following wisdom tooth extractions in order to heal properly. The lower sockets, and occasionally the upper sockets, should be kept clean using an irrigating syringe, which we will provide to you. Begin irrigating on the 4th day after surgery. This means intentionally removing all food particles from the sockets after eating. A common mistake is ineffective irrigation. Irrigating may cause a little discomfort or bleeding for the first few days, which is totally normal. Allowing food to remain in the extraction sockets is by far the most common cause of infection or a dry socket after surgery. Irrigating is usually necessary for several weeks after surgery, and you can use either room temperature salt water or Paradex. If you have had an implant and or bone grafting, then you will not use the irrigating syringe in those areas. Do not chew on the implant or grafted sites, as chewing on your implant or the grafted area can cause failure or loss of the graft.